Welcome to our edition Health and Wellness, and in this session we will discuss a rare uncommon disorder that's a chronic breathing problem, a chronic respiratory disease or disorder called popcorn lung. What is popcorn lung and how you can avoid it? Because once you get popcorn lung, it is almost incurable, irreversible, and there would be no permanent relief. It could simulate COPD, that is chronic obstructive pulmonary disorder. It could also simulate asthmatic attack. It could simulate lung infection. So it would be very difficult to diagnose except with CT scan and biopsy. But how you can avoid popcorn lungs and what is meant by the word, we will discuss in this video, in short video, health and wellness. First of all, the origin of the term popcorn lung. Now, don't worry, popcorn lung you won't get by eating popcorn. Popcorn, perfectly safe, you can eat. It is a chemical called diacetyl. This diacetyl, it is used for a butter-like flavor in microwave popcorn. So when you pop the corn using microwave, particularly when you buy from shops, and if they are using the dangerous chemical diacetyl in order to give it a buttery texture and flavor, it is this chemical which causes popcorn lung. But even without this diacetyl chemical, you can get popcorn lung from other sources, and in fact those are the main sources we will discuss. But diacetyl is one compound, one chemical which is used for microwave popcorn, and this chemical could give you popcorn lungs. That is the name how it is derived. But otherwise, without diacetyl, popcorn you can eat perfectly safe and there's no need to alarm. So let us discuss more about this popcorn lung disease. Now, first of all, the actual medical name of popcorn lung is bronchiolitis obliterans. Now, bronchioles is a name given to fine air tubes. You can see in the bottom left picture, the picture on the left at the bottom, the first wide tube is a trachea or windpipe. The windpipe or trachea divides into two bronchi, the left bronchus and the right bronchus, and then each of them divide and subdivide into smaller and smaller, finer and finer, thinner and thinner branches. So the last, the finest, the thinnest branch, the airways, the air passage, the thinnest branch which goes into the lungs or the air sacs called alveoli, that is called bronchiole. So bronchiole is the finest, thinnest branch of the air passage that enters your lungs or the air sacs. Now, bronchiolitis refers to inflammation of the bronchioles, inflammation of the finest air passage. Inflammation of these bronchioles is called bronchiolitis. Obliterans, because when they are inflamed, they block or clog the air passage. They obliterate the lumen. So obliterating the lumen means the air cannot pass. There is obstruction. There is blocking of the airways. So that is how bronchiolitis obliterans, bronchioles referring to the finest air tubes that enter the lungs, and obliterans referring to blocking of the air passage by inflammation of bronchioles. The inflammation of bronchioles we would call bronchiolitis. So bronchiolitis obliterans is a medical term for popcorn lung. Now, as we told you, one of the main causes of this popcorn lung or bronchiolitis obliterans, in addition to diacetyl chemical, the diacetyl chemical which was used for microwave popcorn, other than that, the main cause is vaping. Vaping, including the e-cigarettes or electronic cigarettes. Now, vaping refers to inhalation of harmful vapors. It's a kind of addiction, inhalation of harmful vapors, including in electronic cigarettes or e-cigarettes. The vapors, when inhaled, might produce temporary pleasure or temporary satisfaction or temporary relaxation. I really can't say because I've never used these products, but obviously they give some sort of satisfaction due to which people get addicted. But vaping or inhaling the poisonous fumes and vapors, that is dangerous, and vaping could be the main cause of popcorn lung. In addition to diacetyl, which is used in popcorn, microwave popcorn, the main cause would be vaping, and vaping could be of several types, including the e-cigarettes or electronic cigarettes that you can see. So, electronic cigarettes and vaping or inhalation of vapors, an addiction actually, as a part of your harmful habit addiction, that could be the main cause of popcorn lung and several other disorders. So we'll discuss more about that. We have shown an example of vaping, the components of vaping, what you get. Now here on the left is e-liquid components. There is flavoring, of course. There is nicotine. There is glycerin and also glycol. So this is one kind of product used for vaping. The actual composition might differ. And then on the right side you have what is called e-cigarettes. E-cigarettes, how it works, the parts of e-cigarettes, the battery, the puff activator, the e-pod cartridge, the mouthpiece. So you have, this is vaping, e-cigarettes and other forms of vaping we have shown, and these addictions are harmful. They could give you popcorn lung, but they could also give you several other disorders and diseases. So this is what we mean by vaping, and we have also shown you what is e-cigarette. Next we will come to the symptoms of popcorn lung or bronchiolitis obliterans. Coughing, a persistent dry cough, something like smoker's cough, especially during and after exercise. It somewhat resembles smoker's cough, a dry irritating cough. Shortness of breath, difficulty in breathing, particularly when you are active, when you are climbing the stairs, when you are walking fast. So shortness of breath, difficulty in breathing, or when you are excited. Wheezing, something like an asthmatic, wheezing sound when breathing. Fatigue, you will feel tired easily, you will lack energy because you are not getting enough oxygen. And other symptoms might include fever, night sweats, skin rashes. So these are not specific for popcorn lung. They could actually indicate any kind of problem, any kind of chest infection or respiratory disorder. So the diagnosis is made mainly on medical history of vaping or medical history of e-cigarettes. If you have been vaping or if you have been using e-cigarettes for a long time, that is one sure indication. Then we have the lung function test or pulmonary function test. plain X-ray of the chest, CT scan imaging, and lung biopsy, that is a final conclusive diagnosis. But remember, in spite of these diagnostic techniques, you may be diagnosed, but practically it is incurable. You can only maintain. The maintenance is there, the management is there. There is no permanent cure. So the only way to avoid it is not to fall into the temptation of vaping or e-cigarettes or any other kind of addiction. So the final conclusion is any addiction, tobacco or chemical flavor vaping is hazardous and fatal, and e-cigarette is as harmful as the usual cigarette. The e-cigarette was introduced as a substitute for a normal cigarette. In fact, they introduced as a way to quit your smoking habit. In order to quit smoking habit, they introduced the e-cigarette, but e-cigarette is as harmful as cigarettes. In fact, people who manufacture and market these products, they usually fool the people because their business depends on fooling the people. For instance, you will remember many years ago they introduced one filter. In those days, e-cigarette was not there. They introduced filter, and people thought that filter means it might filter out harmful products and maybe it is less harmful, but that was just a cosmetic thing, just a name change. Absolutely there was no safety or no protection. The filter cigarette and other cigarettes were equally harmful. Similarly, the e-cigarette, which has been introduced as a substitute for smoking or in order to help you quit smoking, is as harmful as cigarettes. So the only way is not to fall into the temptation of these people who manufacture and market these addiction products, and to stay away from vaping, stay away from tobacco, stay away from nicotine, stay away from cigarettes, and also stay away from e-cigarettes. So healthy lifestyle gives you a very meaningful life which can utilize in many ways for the betterment of the society and for the betterment of your family. So stay away from addiction, stay away from e-cigarettes and vaping, stay away from tobacco, cigarettes, and stay away from all addiction, and enjoy a beautiful healthy life. We shall meet again with more such videos. Till then, thank you and goodbye.